The anatomy of the hip is essentially a ball and socket joint, and it's a deep socket, and that socket's called the acetabulum, and the ball is called the femoral head. Now, what is the labrum? So the labrum is essentially a soft ring of cartilage that circles the hip socket. And here, if you're looking, let's say, straight on the hip socket, you would see the blue would be the socket, and that orange would be the ring around it, that labrum. And here is a artistic rendering that shows that as well. So what is the essential functions of the labrum? So it helps do a couple of things. One is improve stability and reduce stress. And here you could see that it helps deepen the socket. Okay, and deepening the socket will actually help improve stability. The other thing it does is it increases some of the contact area. So you can imagine that it almost extends the socket a little bit, and that reduces some of the contact stresses. And the other thing that it does is it forms a seal. Okay, and this sealing mechanism helps keep the fluid inside of the hip, and that's important, because it helps also keep the contact stresses down. When there's a tear, the contact stresses go up. So these are some of the important mechanisms and functions of the hip labrum. There are different causes for a labrum tear. Femoral acetabular impingement, or otherwise called FAI, is the main topic of this video, and we'll go into exactly what that is. There are other reasons, such as DDH, which is developmental dysplasia of the hip. There's trauma. Sometimes someone could have an injury like a dislocation that can lead to a tear. Repetitive microtrauma, that's really like an athlete who might overuse their hip a lot. You can imagine like a hockey player or maybe a dancer or a golfer, someone like that who keeps twisting and pivoting around the hip, that can get a tear. There's a muscle tendon unit that rubs in front of the capsule, and that could sometimes cause a tear in a very tight iliopsoas. And then there's degenerative labral tears, which is part of arthritis. So again, the main one that we see is the FAI and sometimes the repetitive microtrauma, and we're going to spend this video talking about the FAI. FAI, or femoral acetabular impingement. And so here you'll see all the way on the left side of a screen the normal hip, where you can see this concave, what we call femoral neck. That's the neck of the hip, and you see how that's normal. Now, in the middle picture here, you have what's called cam FAI, and what that means is that femoral neck is not concave, it's convex. So that bump will now keep bumping into the acetabulum, the socket side, and can lead to tears of the labrum and breakdown of the cartilage, and this can occur. And then the last one is what we call pincer FAI, where where the problem is that there's too much bony overgrowth on the acetabulum side, and that can cause pinching. So these would be the two different reasons why people will get this cam FAI. And in truth, many people have a combination. Okay, so here's an x-ray. So on the left side of the screen, you can see the normal concave surface of the femoral neck. And then on the right side with that white arrow, you could see the bump. That would be a patient with cam FAI. Now, an example of a pincer FAI, you could see on the right side of the screen a normal acetabulum and femoral head and neck. But here on the left side of the screen, by the yellow arrow, you could see that's the pincer. That's the extra bony overgrowth that you could see in yellow that we just highlighted. The other thing that sometimes happens with this pincer FAI is that the acetabulum could be retroverted or rotated facing more posterior towards the back. And what that will cause is bumping of the femoral neck and the acetabulum labrum, and that can cause tearing over time. The other reason that sometimes we can have an issue is that on the right side of the screen would be, let's say, a normal acetabulum with normal coverage. Some people can have a really deep socket where there's too much coverage, and that can also cause a problem. And here's an example of a patient with both a cam and pincer FAI. So the white arrows pointing to the cam extra bump, that convexity, and then the red arrow showing the pincer. And here we just highlighted those two areas. And you can imagine in a surgical procedure where we would remove those. Okay, so next issue is, how do you know if you have a labrum tear? Okay, so if you're a patient, how do you know? So some of the typical things that patients will complain of is groin pain. It's very common. So some patients will point to the side of their hip, their back of the hip, but the most common location is the groin. Okay? Many patients will feel clicking or locking or catching, and that's very common also if you have a labrum tear. And many patients will complain of twisting and pivoting maneuvers that will cause these discomforts. The other thing we could see in the CAM pincer FAI is that sitting for long periods of time can actually exacerbate these symptoms because those two bones are bumping into each other for a long period of time in that sitting position.
If you want to be free from this all hip pain,
hit the button now. You have a new life to gain. Otherwise, what are you waiting for? Or maybe going blind will get you moving to find a solution? Or maybe a heart attack will cause you to realize that what you're currently doing is not working? The solution is here, staring you right in the face. Hit the button under this video and get started now. Let me remind you, we don't want a penny of your money. How much is your life worth? Most people would say millions of dollars. Hit the button below and get started. What are you going to do? Put that money towards baseball tickets to a game you'll forget a week later? Or a dinner in some restaurant? Or maybe a pair of shoes that will sit in a closet? Or will you put it towards something that will bring long-lasting positive change in your life for years to come? Hit the button below, then fill out the form on the next page. It's safe, it's secure, so hit the button below now and fill out the form. Remember, once you've been through our easy step-by-step program, it's what you deserve. Click the button below, fill out the form on the next page, and let the good side of your life begin. Thank you for watching, and we will see you on the inside.